I'm going to demonstrate how to take a patient's blood pressure. So you are going to be using the radial pulse on the mannequin. In a person, you may go ahead and use the brachial pulse and palpate that. Start by cleaning your stethoscope. And we'll talk about the proper blood pressure cuff size for your client. I have a medium on. This is a large. I would choose that for clients that had a bigger diameter of the arm. Begin by palpating the pulse, and as you tighten up, so the bulb will be able to inflate the bladder within the blood pressure cuff, and look at the manometer dial. Each one of those lines equals 2 points, so make sure it's easily visible by you. And for every pulse, I'm going to let it puff up about maybe 5 to 10. And when I feel the pulse go away, that is my estimated systolic. And that went away at 130. So I'm going to let that air out. You let your client arm rest for a minute. Now I'm going to be listening for the sounds of the blood pressure. When I place the stethoscope in my ears, I do want it to be pointing towards my nose. And typically you can use the diaphragm to hear most sounds, but if you need to, you can switch your stethoscope to use the bell in order to hear heart valve sounds, which is what you'd be hearing for blood pressure. When I place it on at first, typically you would go for where the brachial is. On the mannequin, you need to find sort of this soft, squishy spot right here, where I'm going to be placing it, holding it firmly. And now I do not hear anything. And as I puff up 30 millimeters of mercury above the 130, so I'm going to now inflate the bladder so it goes up to 160. And then I'm going to open it up slowly, listen for the first tap, the first beat. And I hear it at 132. Can still hear tap, tap, tap. And when it goes away, that will be my diastolic. And it should just slide normally. 78. It's gone now. Nothing. Okay. That is my patient's blood pressure. You clean your stethoscope when you're done. Thank you.